person refused to sit on the back of the bus. She changed the ride for all of us. Oh, that's the power of one. Her diary found a light in the dark. A young girl's hope touched millions of hearts. Oh, that's the power of one. One grain of sand can turn the tide. One single spark can light the night. One simple dream, one gentle word, one act of love from someone can start a chain reaction. It all begins in the heart, in the power of one. While the others threw stones, he didn't judge. He moved the world with the strength of his love. Oh, that's the power of one. One grain of sand can turn the tide. One single spark can light the night. One simple dream, one gentle word, one act of love from someone can start a chain reaction. It all begins in the heart, and the power of one. Oh, all the little things we do every day, the smallest step can bring on a change. Oh, that's the power of one. 'Cause one grain of sand can turn the tide. One single spark can light the night. One simple dream, one gentle word, one act of love from someone can start a chain reaction. It all begins in the heart, and the power of one. The power of one. The power of
Good morning and welcome to another edition of Inclusion St. Louis. My name is Are Obenson, President and CEO of the International Institute of St. Louis. The International Institute of St. Louis has as mission to build a more connected and productive society to benefit immigrants, their families, and the wider society. This mission has a vision, or should lead to a vision, of a diverse, inclusive, and thriving community. This series, Inclusion St. Louis, which is part of our Festival of Nations season, is really intended towards achieving the vision of the International Institute, which is an inclusive St. Louis. And we have been having conversations weekly, and will do so for the next 4 weeks, around this whole notion of an inclusive St. Louis. And this week, we are specifically talking about healthcare inequalities and how they could be an impediment to achieving our goal of an inclusive St. Louis. As part of this discussion, we're very, very lucky to have a panel that has had significant experience working in the community and understanding the healthcare challenges as it pertains to whether it's the immigrant population, the Black, brown populations that do not have the same access as other populations. And so we are going to be tackling that subject with our panelists. And at this point, it gives me great honor and pleasure to welcome, she is Associate Professor at the Department of Psychiatry at the St. Louis University School of Medicine. Join me in welcoming Dr. Mirela Marcu. Good morning, and thank you for joining us. And next we have the Executive Vice President of Affinia Healthcare Foundation and Vice President of Development and Community Relations at Affinia Healthcare. Welcome, join me in welcoming Yvonne Buhlinger. Nice to see you, Yvonne. Thank you for joining us. And also join me in welcoming the President and CEO of Casa de Salud, Diego Abente. Hello, Diego. Nice to see you. Thank you all for joining us. So at this point, we're going to go on to have our conversation. But before I begin with the panelists, I want to welcome all our guests who are joining us, all our attendees, and to say we want to have a conversation with you. We have experts here who can answer your questions. So if you have a question, drop it in the Q&A section of your Zoom, and we'll pick up those questions as we go along. And for starters, I would just begin with the question that I always start this weekly series, and that question is an inclusive St. Louis possible in your opinion? If yes, how? And if no, why? And we'll begin with Dr. Marcu.
Of course, we can have an inclusive St. Louis. I can't even imagine not to have an inclusive St. Louis. As an immigrant, as somebody that I found my home in the United States, I know that there are challenges. I know that my community and our community and your community, everybody's immigrant community has challenges and of course difficulties, and it's maybe harder for many other groups. But thank you for doing this, because I think all the hard work and all this new direction that it's going for the last several years, I think will take us to a much better place in the community in St. Louis area. So I'm very optimistic that with a whole lot of work, hard work, we could get there.
Thank you very much, Dr. Marcu, for that. Diego?
Yes, absolutely. Also as an immigrant and as someone who has chosen St. Louis as my hometown in the United States, I absolutely believe that the region is on a really important journey to become more inclusive. And I think that I would start by recognizing that and celebrating the hard work that many of us have done individually and at the organizational and institutional level to work to create a region that is more welcoming. And I think that standing on that foundation, we have built a system and built a region that has got the right tools to be more inclusive and that can scale that inclusivity. And I think that we see that opportunity, we sense it in the air as folks who work in this space. And we really, our real challenge is to capture and leverage that energy and that collaboration and that desire for our community to be more inclusive and maximize the potential of all of that great energy. And I hope that today's conversation leads us closer to maximizing that potential that's out there, because there are a lot of great folks that make up our community that are working towards this goal. And I think that it is because of that it is absolutely achievable.
Thank you very much, Diego. Yvonne?
Yes, certainly. I think if we do not have hope that we can achieve an inclusive St. Louis, then I don't think we have, we should all move somewhere else, because we really do need to have that hope and work to make this possible. I think today this is a great opportunity to be on this panel and to be surrounded by our audience, virtual audience here today, because to me that means that there is at least 200 people, those who have registered, that are attending this particular presentation, who want St. Louis to be inclusive, who want our communities to be open and welcoming to all. As an immigrant, I have experienced that. Many times I've also experienced the barriers, particularly when I could not speak English and I had a very hard time communicating with people. The barriers were greater to me that day. But I think all of us here today, the audience, panelists, we just saw that video, The Power of One. We have that power. We can exercise that power by every day, just smiling to someone, being welcoming to someone, extending a hand, opening doors, being helpful, elevating. I think that's what it takes, especially when we expose children and guide the children the right way. We're going to see our future really blossom, and St. Louis be just really, a much better community when we don't have inclusion for all. And I guess I don't want to go too far down that path, because I know we have many topics to cover. We can see how the entire community suffers. And we have seen that clearly with the threat of COVID-19, where those communities that have been more isolated, disenfranchised, and they tend to be the Black and Brown communities, have been greatly impacted, and that has resulted in ripple effects to the health and the economy. And that is true on an everyday basis. We may not see it every day as clearly, because this was such a concentrated crisis all at once, but that crisis is there every day, and we need to work together. And it's so wonderful to be here on this panel with Diego and Mirela and you, Are, and others. And there's so many other leaders that may not be here today as well, but as Diego and Mirela have pointed out, or I should say Dr. Marcu pointed out, it's there are a lot of leaders, and that also gives us hope.
Yeah, it looks like the community is onto something. We feel that there's been a lot of work done. There's energy around working towards having a more inclusive St. Louis, and we're hoping that through these conversations we also play a small part in advancing that initiative or that movement towards a more inclusive St. Louis. And thank you for being here. Before we even get on to talk a bit about the inequalities, maybe good for us to and for our audience to get to learn more about your work first, with especially dealing with healthcare inequalities. And I'm going to start with you. Let me start with Diego, since Yvonne just finished it. Diego, talk to us a little bit about the mission of Casa de Salud and how it pertains to this conversation about healthcare inequalities, especially for those with limited access.
Yeah, of course, absolutely. So CASA's mission is to facilitate and deliver high quality clinical and mental health care services to our region's under and uninsured. And we focus particularly on immigrants and refugees who encounter barriers to accessing this care from other sources. And the way we do this is by building a model which is founded on partnerships. So all of our medical and mental health providers are volunteers, and some of them are just getting started in their careers, some are retired, some are semi-retired, and they all work together and mentor other aspiring doctors and therapists. And what happens at Casa and what makes Casa unique is that we surround that technical expertise, that medical and behavioral health expertise, with multicultural, multilingual staff, folks who have sort of walked in the path of the immigrant, who understand that journey. And so what we do by putting these two incredible forces together here in our region is we provide patients and clients the inclusive care that they need today, the support that they want right now. And at the same time, we're building a more inclusive healthcare safety net for tomorrow. So we're helping these folks who have gone and really honed their skills, their technical skills, also gather some cultural and linguistic sensitivity so they can better apply that knowledge when they are providing care across cultures. And so we do that in three very important ways. The core service that we provide is clinical healthcare. So, you know, if I have an issue with my shoulder or with my elbow and it hurts, and I am an immigrant and I find that it's difficult for me to access care elsewhere, I can come to Casa, and Casa's only question is, where does it hurt and how can we help? And if we can't help on site, then we can do that by connecting folks into the wider healthcare system to find that specialty or follow-on care that we at Casa cannot provide. And we do that through our second major program, which is our guides program. And the guides do exactly what the title sort of implies. They help people along their health and wellness journey to ensure that we close that circle, that virtuous circle of seeking, receiving care, and then becoming well and productive in the community, in our neighborhoods, and for ourselves and our families. And then our newest program is our mental health collaborative, which I like to equate to sort of the startup space and this idea of creating an intersection where you're bringing together incredible talent to meet a well-known need, which is support in the behavioral healthcare space, so that folks can learn how to be, again, better therapists. They bring their skills and their knowledge base from their education. And through that support that Casa's multicultural, multilingual staff provides, they learn how to hone those skills to provide healthcare across cultures, which is something that's not done as often as we would like in our region. And so by doing all of this work, again, I'll come back to what I said earlier, we're not only solving today's problem and providing today's service for the needs that are required, we're also building a more inclusive healthcare safety net system for tomorrow, which we hope will help build a thriving and stronger region.
Thank you very much for that summary of the incredible mission that Casa de Salud, I mean, doing incredible work in the community, and I'm hoping that the people out there who are facing the challenges, they know where to go to seek solutions or even advice on how they can address this. Let me turn to Mirela to talk a bit about your work. I know that you do treat patients who are immigrants and have offered cultural and community treatment for underprivileged patients. From your perspective as a practitioner in this community, what are the most important steps we should take to reduce healthcare disparities, for example?
I think that's a pretty complex and long question, and probably we can talk so much about it. But I'm already glad that, Diego, you're already saying some of the things that, I have to say. In some ways, I think the audience is going to be here, theme of the discussion. And I'm glad that, we're all sort of expressing, ideas and themes in that direction. Because one thing I have learned over all these years is that teamwork and integration became really the key of becoming successful in treating immigrants. So our patients, it's not that, we offer medications and DSM-5 criteria and so forth, because I think that's the usual thing that we should be doing, but really trying to extend the lessons that we learn from our immigrants through, social, studying social aspects of their cultures and studying their history and so forth. So we can understand somebody, if we do not know their climate, we don't know if somebody is coming from Rwanda, what they have gone through, if we do not understand, the social climate of it. So I think it's just becoming to be a beautiful program where we're learning about human beings. And most importantly, besides, again, treating and giving medications, but I think we have to adapt these medications and we have to adapt these treatments to these people, who these people are, their communities. Do they use or do they not use other methods like homeopathic medications? Do they use the help of their spiritual leaders? So we really have to understand those things. And for that, the teamwork is very, very important. I think that, moving forward, what we, keep talking about, and actually at St. Louis University, we just have a, very strong committee of diversity, equity, and inclusion. And we like that idea. And we like that, maybe down the road, we're gonna extend it to the larger community, where we see that, the inclusion actually of many people from the immigrant communities is going to be a huge and contributor to understanding this community, because what better people to understand their own community than the ones that are coming, from the same communities. Our job and my job is to teach people that actually we're so much more alike than diverse. I think we're diverse, and their diversities, I think that's the key of establishing good treatments. I think access to medical care, it's becoming like it's one of my biggest problems, and I think Yvonne, you said it very well. This past year, with COVID, was just another example of access to medical care. It was I have patients that are returning now to the treatment, and unfortunately, this will be a trend that, we could have them back in the office, because they don't know how to use a system, and they don't know how to, they were giving appointments after appointments. And then I think in a normal setting, they would have been kicked out from the clinic, because, they're like 3 appointments and they're missed appointments. So accessibility. So, and maybe just the first step, as I said, inclusion of, some of the people from the community will help them maybe, bridge that gap of making appointments and so forth. Breaking cultural taboos in some communities. I think we're still working on that. And I think the last several years were incredibly helpful to include community agencies and to include leaders, spiritual leaders. I think we like the conversations with various community leaders and, imams and different, priests. Or so just generally, I think having the community leaders on our side, and especially when it's coming down to mental health, I think it's very, very, very important, because, we're trying to help people that we're not trying to eliminate who you are and who you're believing, what your beliefs are. Those can be absolutely integrated in the modern medicine, and we can help you with medications, but you don't have to believe only on your medications, like you're, believing in your faith and spirituality. It's absolutely a crucial, part of who you are. But for that, again, we need a community together, and we need a collaboration, and we need to be working with, other agencies. Integration of medical system, it's also a problem. And, there are steps in the community, and, those are past and beyond the scope of my, desire, what I want. But it's so much better now that we have some of the medical systems that we kind of can read about each other, what they do and what we do. But unfortunately, smaller agencies, like even my own programs, like, my own little grants with immigrants, we can't see each other. So then what I'm trying to say, you have very scarce resources. And when you use those resources, we have to use them well and judiciously, because then, I can do a set of blood work, and then, Affinia does another set of blood work, and maybe at your agency, Diego, somebody. So, trying to speak that, we could use that, and also we could see what, left hand is doing and right. So then integration and well, we have to see how we could even extend some more, a little bit of collaboration, because we're already collaborating in the community with some of the, family care physicians and many of the people working in the community, the providers. They're not necessarily in the mental health, but they're so well trained and they know so well how to work with this community. We talk about next steps, funds and grants and so forth. I think as a community, if we had the chance to work together and sort of put our efforts together, I always think that we're going to be so much more successful in getting some of these service grants rather than, communities separated as, and separated entities will be able to, to obtain the grants. So these are some of the few things that, in my mind, and we're trying to work.
Yeah.
They're very, our challenges are incredibly difficult, like getting people how to know how to get Medicaid, getting these people. I'm just saying some examples. We have special forms to complete that for immigration. We just have to get into the, knowing the community's needs.
Yeah, I think I would love to come back and for us to talk about what those challenges to access are eventually. I would like to, Yvonne, I would like to learn a little bit about, Affinia Healthcare and Affinia's foundation aim at addressing unmet healthcare needs of the most vulnerable populations of St. Louis. Can you speak to some of Affinia's initiatives that aim to reduce these healthcare disparities, just like Mirela has been mentioning?
Sure, certainly. Well, all of Affinia Healthcare's work every day aims to reduce disparities. It is really what we do. We have been serving St. Louis since 1906 at Affinia Healthcare, our community health centers, and through that history, we have been focused on the most underserved and people with the highest need in the community. In fact, back in 1906, we began serving the newly arrived immigrants to the surrounding area, and gradually, as we expanded, we began to serve others who had great needs. So currently, we provide care to over 43,000 patients. And 90% of those patients have incomes under 100% of the poverty level. And almost all of the other ones, the other 10% have incomes under 200% of the federal poverty. So people in great need. And of that number, about 70% of our patients are Black and 14% are Hispanic. And then a smattering of patients from many other cultures, making up about 11% of patients who receive their care best in another language. So that's just kind of showing the breadth of what we do in terms of that diversity. All of our staff through our 12 locations, 10 of them are in St. Louis City, 2 are in St. Louis County, are trained on trauma-informed care. All of us as staff went through also some special training, just awareness training, to be as welcoming as possible to LGBTQA+ community. So diversity takes a look at Affinia Healthcare at many facets, in many ways. Our staff is very diverse. We provide interpretation service to all of our patients, in various ways. We have it available during all of our events and every single service, so that barrier can be eliminated as much as possible for our patients. And we also have many partnerships. So as Dr. Marcu was speaking, we have a partnership with St. Louis University for psychiatric care, where that service is provided to our patients in part by St. Louis University, in part by our own staff, psychiatrists, and other staff in that for behavioral health for children and for adults. Diego and I recently had some opportunities to collaborate on community kinds of activities, and on a regular basis, sort of back and forth with patient referrals, that sort of thing, and with other entities in the community, Washington University, BJC. In fact, Affinia Healthcare delivers about 24% of babies that are born at Barnes Jewish Hospital. So we have a very robust presence and provide that care in a way that is culturally competent, compassionate, and just like our mission says, which is to provide excellent quality of healthcare services, exceptional customer service, and promoting healthy lifestyles. And our foundation began 4 years ago. So the foundation is not as old as our community health center that dates back to 1906, but our foundation was started because we need additional resources to continue to address the inequities, to continue to expand and provide more access as we expand collaborations, and we also expand, continue to look at the need in the community, that we need those additional resources. And there's more that I can say about that right now, but we essentially, we're just here to serve and address disparities such as infant mortality, prenatal care outcomes. In St. Louis City, 14% of babies are born premature or underweight. That compares to Missouri average of 8%, national average of 8%. If you take a look at white babies born in St. Louis County, about 8% are born underweight or premature. That's a huge gap right there for St. Louis City. And then when you look at Black babies in the city of St. Louis, that goes all the way up to 18%. That's a huge number of babies being born premature underweight, and that already starts their life with many needs that will or can translate into inequities of outcomes in their own health, and just harder road in life if they're impacted with having smaller lungs that can lead to lifelong asthma, issues like that, cardiology, kind of related issues, and just cognitive issues, just a myriad of issues. That's just one example. Opioids have exponentially, the deaths by opioids exponentially increased in our region, especially amongst Black males in the past year throughout the pandemic. So we have a medication-assisted treatment program to address opioids and collaborations across St. Louis City and County government for justice-involved individuals who have minor violations, that we can, assist them with their, substance use needs. We have integrated Narcan distribution at all of our COVID-19 testing and COVID-19 vaccine locations, and we've provided over 29,000, a higher number than that, tests, COVID-19 tests in our community, over 15 or 16,000 vaccines. I don't have the exact number right now, but it's something like that, vaccines since January. So these are robust efforts to address the disparities that we're seeing, that are longstanding disparities and even the current disparities because of COVID-19. A very nice friend has just put something on the chat pointing out our collaboration between Affinia Healthcare and other Latinx community organizations. And we're here to serve.
Yeah, thank you. I just saw Maria's comment there. Now, it seems like there is collaboration going on. We have the three organizations here represented are actually doing work. The first thing that I would like to ask you all, so we're speaking to the community here, is why is it important as a community for us to address these inequalities that exist? Why is this vital to our progress as a community? and anyone can take this. Let's say, Diego, let's start with you. Why is this work important?
I think that for me, the reason is at once simple and complex, and that is that we're all connected, and that as a community, we need each other, and we make each other better, and we make each other stronger, and we help each other grow. And so we are smarter if we think about not only our own well-being as a family unit, as a neighborhood unit, as a city, as a region, but also of those around us and those who live with us. And so I think that's important to think about these inequalities as affecting us all in different ways. At some people, obviously, much more directly than others and much more systemically than others. But I think we would be wise not to believe that just because we don't suffer directly from some of these inequalities, that they aren't affecting us in our lives and in the way that we interact as a community. And I think that that's what, for Casa, really is a guiding principle in how we treat people. And that is that we really don't ask folks many questions about who they are, where they come from, but rather what service they need and how can we learn from them and their needs to become a better organization and to share that knowledge and that history with others in the community so they can also become better service providers. And so I think, COVID is a great example of what happens when we don't take into consideration the all-encompassing effects of inequalities in a particular community. And in fact, right here, right now, in the last several days in our region, it has been increasingly clear that just vaccinating some people in the community isn't good enough. And even though those that are vaccinated may be intrinsically more safe from COVID-19, it doesn't stop affecting them that others haven't received access yet and haven't been communicated to in a way that validates their questions and doesn't just validate answers. And so I would urge folks to think about the spread of the Delta variant and the various waves and the evolution of the pandemic, especially in our region, as a great sort of living example of what happens when we don't think about the problems that affect certain communities as problems that affect all communities. And I think those of us around the Zoom gallery and those listening are probably thinking about these things, but we also need to speak to those that are in our influence groups about this importance of working together because we're in this together. And as much as we may think that we are not connected, we are absolutely connected. And as I or as anyone on this Zoom panel grows, the community grows. And as I or as anyone on the Zoom panel suffers, we all suffer. And we need to sort of keep that in mind and not lose sight of that. Because if we do, we get ourselves into situations like we've seen in the last couple of weeks where, again, using the example of the pandemic, the few who haven't received true access may really be adversely affected. And that, again, affects us all.
Well, thank you very much for that response. It's incredibly important for us to, especially in the context of everything that's going on now, to really look beyond ourselves and see that our destiny as a community is so intertwined. We're going to come to the questions. We have 2 questions already, but to the question that Diego just responded to, if anybody else, Mirela or Yvonne, if you want to add to that, please feel free.
Yeah, I think I will add that, we have long-standing inequities in healthcare in our community, and health is a human right. And when we see, people who are, suffering because of chronic illness, that starts at a very young age for the communities that are disenfranchised, whether it's immigrants or the Black individuals who live in our community, that we see, higher incidence of the result of that. For example, with diabetes, that people end up having to get dialysis as part of their daily lives. People lose limbs, things like that. So from strokes, people end up with disabilities at a younger age. So we see in the communities that we serve at Affinia Healthcare that there is a high number of individuals who are not able to participate in their daily lives because of that inequity, and that impacts our region. When we see companies like Amazon, or others that might be we desire to bring some additional economic benefit to our community, or just from the economic benefit of people working and participating on a regular basis in the workforce, we're losing out on that because of people, in addition to the COVID-19 and the recently has impacted so heavily Black and Brown communities, is because they already had a lot of compromised health issues, and also because of the lack of access to resources and just a myriad of other issues. But we need to continue to address healthcare as a human right if we're going to have equitable participation in life for everyone in our community.
And for our clinic, and it's the focus on understanding cultural differences that might keep a community, a certain community, to be a lag behind, the general community of St. Louis. So, the level of acculturation, education, and of course, of resources that's all together coming in one, and language barriers and all the other things. And so trying to do the best, educate ourselves, educate the residents, the students, to be good listeners, to understand these communities and see if there is progress that can be made. It's let's see what can we do about that. So
yeah, we have 4 questions, and Mirela, I'm going to stay with you because there is a question which says, if you're working with or talking to students in the healthcare field, what message would you want students to hear, or specific topics? And I think that ties with what you were just saying. This is a question from Stephanie Lucas.
First of all, I think our students and residents, they have to get used to the model of listening to somebody. Again, we're all so alike, but we're so different. And understanding of all those differences, I think these should be part of our clinical practice. We really have to see who sits in front of you, what's the culture they come from, what's respectful for them, what's not respectful for them. You need to, as I said, we need to know their social climates, where they come from, because otherwise I think it will be difficult to understand what these people, have to go through. And also the social climate where they came from in terms of education, cultural norms, and so forth. So I think that's something that, students actually, they really like to learn about people. They really like to learn about historical events. So it's sort of like expected in our clinic that you do know a little bit of a history about, where people come from. You expected to know that this country is in this continent. You expected to know that it was a genocide. So those things that I think it's such a complex integration of social history and human rights and all that stuff that it's included into really medical care. And nevertheless, we're applying really principles of ethnopsychopharmacology, meaning that although we're so much alike, but we also could have differences in terms of how we respond to medications and how we metabolize medications. So all those aspects that supposed to be learned working with immigrants and refugees and just diverse populations generally.
Thank you for that. We have another question from Don Log, and he's asking, and this may be Yvonne and probably Diego, you can take this, but he said, what are we doing as a community to achieve collective impact across the full spectrum of healthcare providers, insurers, so that every community has equitable access? Let me just add that this conversation is one of the ways in which we're coming together as a community. As you can see, there is ongoing collaboration and we only hope that it gets better. But I'll allow Yvonne to take this, and maybe Diego, if you have something to add to that.
Sure, certainly. So, there's quite a bit going on in terms of collaboration across many healthcare entities in our community. There are actually even some institutions that are dedicated to doing that, in addition to, something like this, which is, great for awareness and discussion. There's entities like the St. Louis Regional Health Commission, for example, where their mission is to explore where those gaps exist and bring together those participants in caring for the uninsured and underinsured, so that we can have effective collaborations and collaborative advocacy. Also, the St. Louis IHN Integrated Health Network also has a similar kind of mission, and they actually provide some services. And Affinia Healthcare participates in those entities, as well as at the Missouri area level with the Missouri Primary Care Health Association. We are now a United Health agency, so we also have opportunities to, from a systemic, sort of process, to be part of many of these conversations and systems. Dr. Melissa Tepe, who's our Chief Medical Officer, she represented, or represents still, I should say, the community health centers in the pandemic task force, for example. So initially the pandemic task force was formed by the different hospitals, and those conversations were being held in terms of what can hospitals do. And that's where, it was identified that there was a little bit more information needed, boots on the ground collaboration, and the St. Louis Regional Health Commission and IHN proposed for Dr. Melissa Tepe to be that person. And so she's representing all of the community health centers in that task force. So that's just one example, but I think a really good example too is the advocacy that has been behind Medicaid to be expanded in this state. That has been a really long and difficult road, but I think right now we can celebrate that we're starting to see that light turn on. I wouldn't say at the end of the tunnel, but that Medicaid will expand in our region. And what that means is that many adults that have incomes under the federal poverty level even did not have the ability to qualify, apply for Medicaid. So then the expense of healthcare made it very, very difficult, another barrier for them to access healthcare, not just preventive care, but all other healthcare on a regular basis and the way in which they should receive it. So we are certainly very happy to know that Medicaid will expand. Now, all the details of that, we can all certainly collaborate to influence that, but the details of that, exactly what does that cadre of services and benefits will actually include, we're still waiting to hear more about. There is collaboration. There's a lot of partnerships. Affinia Healthcare certainly has partnerships with IISTL University, for example, to bring dental care, not just preventive, but also specialty dental care to people in our community. And it's located right here in the city, surrounded by public housing, so that we can be sure to be very accessible.
Yeah. Thank you. Diego, I'm sure you maybe want to add, but we're having so many questions, and I want to try for us to cover as many as possible. Diego, can you just speak about the immigrant? So there is a question from an anonymous attendee which talks about how can an immigrant basically get basic medical care assistance or subsidy in this community? If, I know you also have a background with the International Institute, so you have a good understanding of how an immigrant can have access to medical care in this community. So if you can speak to that, that would be great.
Sure. I think that the first thing that we have to acknowledge is that it's hard. and it's costly and it's time intensive if you are not already inside the US medical system and you are not covered by your insurer. And we have to acknowledge that. So getting care as an uninsured immigrant is hard, is time consuming, and is costly. And I think that by answering this question, I can also touch upon the former two questions, and that is that the first step is to acknowledge that difficulty and that disconnect, and to then think about designing services that can pave the road to the bridge that gets people the service they need. So oftentimes we talk about people, bridging divides and bridging gaps, and I think what we forget about is that we assume in the analogy that people can get to the bridge and that we're just building this bridge across the divide. But the reality is that a lot of people can't even get to the bridge. So a bridge in the middle of nowhere is good to no one. And so that sort of speaks to the challenges that immigrants have with receiving healthcare. And so Casa is established, is built, our model works because as a nonprofit that is fairly small, with fairly specific services, we are able to serve people regardless of their status, regardless of their insurance status, regardless of their nation of origin or where they live, or what their problem might be, or their need, if you will, might be. And we do this by keeping ourselves nimble and small and flexible, and by also partnering. So we get back to this idea of the way that an immigrant can receive healthcare in St. Louis, in our region, if they are not already insured, is through collaboration, is through partnership, is through coming together individually and as organizations to rally our resources. And Dr. Marcu talked about this much earlier, rallying our resources so that we can leverage them for the benefit of the people who need them most, and acknowledging people where they are in the community and when they need the service. So not just building large infrastructures and expecting people to make their way to those large infrastructures and sort of a one-stop shop approach, which really doesn't acknowledge the realities, the difficulties, the priorities that an immigrant might face. And what I don't know, I know a lot about Latinos because I am a Latino from Paraguay. And so I can speak about my culture, my upbringing, my stigmas as a Latino, but I know very little about many other cultures. And so being humble and being curious and wanting to learn has a lot to do with how we can provide better service, better healthcare in particular, to immigrant communities here in St. Louis. And we've got a lot of great resources that can help us learn what we don't already know, and can then help sort of create a feedback loop so that the services that we build are more flexible and more nimble and can adapt to many different cultures. So I can't learn every single language and culture that's out there, although I'm curious to do that. I know I don't have enough time on this earth, but I can learn certain skills and tools that will make me better at identifying differences, right? And so, the answer is that our commonalities bring us together, but it's the diversity that creates and drives that great conversation and that drives creative and innovative solutions, right? And so that's how you serve the immigrant in our region, is by creating those innovative, creative, out-of-the-box solutions. And you can only do that if we all come to the table, both individually and as organizations, around our commonalities, our humanity, but with the curiosity to learn about what's different and how those differences create these really smart solutions that you, me, and a bunch of other clones of me could never have thought of. And then the last thing I'll say to sort of think about, to help us think about how we can serve the immigrant, is to really think of this. Culture drives language. So the words I use are words that my culture has helped me learn and replicate and repeat. And language communicates culture. So the words I choose to communicate my healthcare needs have come from the way that my culture interacts with healthcare. And so I think as we're thinking about students and creating and building a more diverse and more inclusive healthcare safety net, we need to train ourselves as providers and as healthcare providers in particular to be cognizant of that and to ask questions and to do the best we can to set aside our own biases, to really be curious and learn about what exactly is being said from that cultural perspective, which is different than our own. And that's much easier said than done. It's a lifelong learning journey. And I think that we can do that in this region because we have people like the folks again around the Zoom gallery that are interested in learning and becoming better, and through their individual journeys make their organizations and those collaborators in our region better at addressing these multicultural problems, which of course we don't all intrinsically have an answer to, but we can learn to work together to build those answers and provide that service that's needed.
Thank you very much, Diego. We have about 7 minutes left on the program. We still have about 4 open questions, and I just wanted, I know Eileen Wolfington, as we would really want to know. She's with LifeWise St. Louis, and basically her question is how can not-for-profits that are serving low-income and diverse minority populations be able to connect with Affinia, with Salud, and Casa de Salud to offer culturally adaptive, emotional, and physical wellness programs to their clients. So, and whilst you're responding to that, how these not-for-profits or even immigrants or individuals can contact you, can you also just take a minute to have your closing remarks, which could be really about what you're hoping for the future for us to be able to not just bridge the gap, but really move towards providing access to everybody in the community. And I would start with you, Yvonne.
Yes. So to contact us, if you work with another not-for-profit or community organization, or if you would like to be one of our donors, you can contact me. And that is at Yvonne, B-U, so Y-V-O-N-N-E, B as in boy, U, at affiniahealthcare.org. That's my email. You can also go to our website. You can find, I think my email is right in there in the contact area, or any of our staff can direct you to contact me for those purposes. If you're a patient, somebody who's trying to help somebody else receive medical, dental, behavioral health, substance use disorder services, and any of these, services, whether they're an immigrant or somebody else who needs us, that is 314-814-2700. That is our appointment line. And the hope that I have is that we all continue to, I'm sorry, I provided the incorrect appointment line. That is 314-814-8700. So hopefully you noted that correctly. And, that we all continue to partner, that we all continue to advocate, and that, people feel that there is hope, and that they work with that hope in mind, that we elevate others, and we, help make the difference that we want to see in this world come true.
Thank you. Thank you very much, Yvonne. Mirela?
Well, I would close with saying that, access and remains a problem for resources. So definitely we're always appreciating anybody who has more suggestions for us how to, improve or get more access to resources. I'm happy to be part of any community work. My email is marcum, Marcum, at slu.edu. And any time I'm hearing from you, I would appreciate it.
Thank you very much. Diego, your closing remarks here.
Just as I was about to forget I was muted, I remembered. This is monumental. I remembered I was muted. So yes, contacting Casa Salud. Folks who want to learn more about how we can help, they can call 314-977-1250. And learning about what Casa does and communicating with me or other folks at Casa can be done through our website at www.casadesaludstl.org, which is CASDESALUDSTL.org. And I would say that, I'd be remiss not to end sort of reminding the community, myself, and the people that I care about in this community about what we're going through in this iteration of the pandemic, and really urging folks to think about what it'll take to end the pandemic, because only and only when we end the pandemic can we start the healing process. And so St. Louis's next big question, I think, in our journey to being more inclusive is how do we recover from the pandemic? But we can't start that work until we end it. And when we end it, we have to recognize and acknowledge that healing all of the harm the pandemic has caused across all of our lives, every single one of us, is going to take time. And the big charge there will be to do it in an equitable way where folks are recovering, each and every one of us, recognizing our individuality and recognizing all of the needs that we have from other folks' needs. And that's, again, very easy to say, but very hard to do. And I think, again, we have great resources in the community to do that, but we can't start that really important work and our next big step in this inclusivity journey that we're on in our region until we end the pandemic. So I would urge folks to think about that, talk to people, and be resources, validate questions, and help them understand everything they need to understand if they haven't yet been vaccinated or have questions about vaccines, so they can take that next step, whatever it may be, whatever's right for them and their family. And we can start that really important work of recovering from the pandemic and helping people really unravel all of the pain, hurt, and harm that's been done over the last 20 odd months.
Thank you very much, Diego, Mirela, and Yvonne, for doing this. This conversation is going to continue. I hope it doesn't end here. Next week's topic is going to be about projected big arrivals of refugees into this area. Is it an opportunity or a challenge? And I'm going to invite our audience to be back again. We're going to have a very engaging panel. And I just want to also plug in that we are moving towards our grand finale of the Festival of Nations, which is going to be on July 28th at 9 Mile Garden, and it's going to run from 11 a.m. to 8 p.m. We're going to bring this community together. We're going to demonstrate and display the diversity, the rich diversity that lies within this community. And this conversation is going to continue. I said July 28th, it's actually August 28th. August 28th. So the end of next month and not July 28th. But thank you for being here. Thank you to our audience. Thank you for the very exciting questions. I know we still missed 2 questions, but we'll make sure we reach out.
Thank you for having us. Thank you.
Thanks for the invitation.
Thank you very much. Thank you, Yvonne.